Hey, it's Chris Byer.
Chris Bowling, good morning.
CB, good morning.
How are you?
All right. So
Yeah.
last couple of weeks we had Bottom Line Thursday with Brad talking about increases across large employer groups, the ACA marketplace. Everything's 8 to 10%, if not more, in surveys and anticipation, benchmarking, all of those things across the
Right.
country. So as we're coming into renewal season, that's not a great number to start with.
That's horrible. For the clients that I don't want to say deserve because that's not a kind word, but for the clients that are having bad claims, we expect it to be
Yes.
that high. But man, based on those two big surveys on the employer market, especially the self-funded
Yes.
employer market, it's kind of scary to think that our budgets, so fixed cost budgets, our budgets
Yep.
could potentially be going up 8 to 10% to cover a wide variety of things, right? GLP-1s, we've
Yes.
pounding on that, but man, you and I are still seeing stage 3, stage 4 cancers, that they're just not
Yes.
getting checked, they're not getting the preventative. I just found out
Yes.
was it Monday that we have a or yeah, Monday that we have a stage 4 colon cancer, that poor
Yep.
person and the journey they're going to have to try to beat that's going to be difficult. And
It's gonna be tough.
that's going to be a $500,000 claim. I mean,
Yeah.
we know it. And
So
so,
it'll be interesting too. I mean, as we're trying to put as many programs and solutions in place to control pharmacy costs to, offload risk of organ transplants, those are definitely helping bend the curve. But you're exactly right. I think we still have to continue to push on wellness and preventative, make sure that employees are getting in and getting their screenings because we're not catching stuff early enough. And that could be cardiovascular, that could be diabetic, that could be cancer screenings. I think this is the year that we're seeing employers look to invest more in programs that actually just get people in to see the doctor. It may not be a true wellness program
right,
where you're getting your finger stick in what's going on, but let's get you screened and get you back on that journey because everybody got behind and they're still behind 5.5 years
behind.
later.
And I found what's interesting over the last couple of weeks that we've been traveling all over is
Yes,
based on last week's recording. The clients that are performing really well, that are having really good years, they're pushing for change. They're pushing to add things like, do we
yes,
talk about a weight loss, a Wegovy, Zepbound coming back into our plan
mhm,
because we're starting to see some long-term, improvements. Obviously, there's also long-term risk, but mental
yeah,
health, we're talking about point solutions. It's impossible
yes,
to get in to see somebody. So I think it will be a year for change. I mean, you and I have already had all of our pre-renewal meetings, and I say it's going to be a year for change. And I think some of our clients are just saying, if it's working, don't don't mess with it. But I think our clients
yes,
that are performing the best, they are pushing for not change, add-ons. Is if we
yep.
add this, can you
Just
add?
optimize it.
Yeah, and I'm excited because I love stuff like that. It's
Yeah.
nobody likes something that's just stagnant.
And I think our conversation with so many of our fully insured clients is just that. If you're looking at an 8 to 10% increase out the gate, it's time to take a hard look at self-funding. So we're doing a lot of self-funded feasibility analysis with our data team and saying, okay, here's the probability it's going to work. Now let's see if the market will accept you for stop loss,
Right.
but you can get some control. I look at the main two states that we're in, Iowa and Illinois, although the
Yep.
clients all over the country. That's where a majority of our clients are. Both are seeing increases in pharmacy costs. Both are seeing state mandates. The fully insured market is going to get hit hard in those states, and employers have to have an open mind to self fund. That's not the only answer,
Right.
but
Right. Right.
when we see one or two carriers in each state, fully insured is just going to have to go by the wayside for a lot of clients.
Well, you and I have 4 clients fully insured having a horrific year, and I don't
Yep.
even I dread the day that I get that renewal and having to tell the client your rates are going up. It's going to be a heck of a lot more than eight to ten. 8 to 10 would be a
Yeah.
gift, but it's going to be
Yes.
high double digits. So
Yes.
the ones that we struggle with because they're just having a bad claims year, or they've had multiple bad claims years, and we could never tell them to go self-fund it just because their budget would just
Yep.
blow up. But yeah, it's going to be a fun year. We're excited to start getting some renewals. We've had a couple in, but the big push will come in about 4 days. So
Yes. It's coming. So
yes,
no. More to come, but it was always good to hear Brad's survey updates just to
Yeah,
be aware of what's happening. And it's not just Iowa, Illinois, that is national. So it is everywhere and in between. So it's these large employers, these large consortiums have not solved the problem. So it's going to take ideas like we're talking about to help these individual clients.
love it. Thanks for sharing.
Yep, absolutely. Good to see
All
you.
right, we'll see you. Bye bye.